So I grew up in Franklin, so just south of Bowling Green. And then I moved to Nashville for 4 years. I went to Belmont University for college. And then I went to Cincinnati for medical school. And then I practiced there for about 10 years. So we just moved back to Bowling Green in June of this year because our family is here.
And tell me a little bit about your family.
So we have 3 daughters. They are 9, 5, and then 3 months. And so it's busy.
Busy, busy, busy.
Yes, yes.
So what made you decide to become a doctor? Is this something from your childhood you knew you wanted to do?
It's a great question. I knew I wanted to go into medicine. I actually had planned to go to nursing school. I was going to major in nursing in college. And I have an older sister who was in medical school when I was a senior in high school. You know, she said, I really think that you should just consider going into medicine and going into medical school. And it was a little scary, the amount of time that it takes for school and training. I was kind of intimidated by that and what that would mean for the next several years. But I remember her saying, you know, it's not gonna seem like that long when you're looking back on this time of your life. I chose pediatrics pretty early because it's just a lot of fun. Kids are a lot of fun. And you know, once I was able to work with kids and have the time in pediatrics, there was really just nothing else I wanted to do.
Well, you're pretty much a hometown girl, so we kind of know a little bit of this answer about what attracted you to Bowling Green, but speak to that as well as what attracted you to Graves Gilbert Clinic.
For us, we weren't sure that we would ever move back home. You know, we call this area home. My husband and I both grew up in Franklin. It's always been home to us, even though we were gone for 20 years. We weren't sure, you know, what that was going to look like for us as far as, you know, if we would stay in Cincinnati forever or not. Actually our oldest daughter, about a year ago now, started to say that she really wanted to live closer to her grandparents. I came to interview with Graves Gilbert to see if it was even an option for me career-wise. And I was really impressed with the group, with Graves Gilbert in general. You know, I liked the pediatricians I met here. I was eager to work at this location with Dr. Cherry because we needed another pediatrician here. And it just seemed like it was the right time for us.
What special skills, experiences, or services do you bring to this area that others may not offer?
So, you know, the first 5 years that I was out of training, I was still working at Cincinnati Children's, and I was working in the ER and urgent cares. After that, I moved into an office setting, and I spent 5 years working in a clinic and seeing patients all day, every day, and doing checkups, and also, you know, seeing them when they were sick. And so I think that experience combined is really helpful because I got the experience with the sick kids and feel comfortable with that, but then also spent, you know, 5 years doing the checkups and working in the office.
That's really neat. Let's end with this. What would you say to someone who's considering you as their child's provider?
I would say I think it's really important to find someone that you're comfortable with and that you feel like really cares about your child and you and your child's health. I think that is what we all want in our doctors. And hopefully that's the way that parents feel when they bring their kids to see me, that I'm engaged and that I really do care about their child, because at the end of the day I do. And I hope that they know that, and I hope they feel that.